Hello students. So we continue further our discussion on mental diseases. So in the last presentation we saw the first variety of mental diseases, that is mental symptoms arise with decline of corporeal symptoms. So what is a corporeal symptom? It means a physical symptom. So mental symptoms arise when the physical symptoms decrease. So what is the meaning of these? Mental diseases or emotional diseases are like corporeal or bodily or physical diseases. So we already saw what are mental diseases. They are the symptoms of mind predominant in the case. They are the symptoms of mind which are predominant in the case. So mental or emotional diseases are like the bodily diseases. Now we see the first variety. Mental symptoms arise with decline of corporeal symptoms. In this case, the physical symptoms are very small and it appears one-sided diseases like a local disease in invisible subtle organ of mind. Means what? In invisible subtle organ of mind. So it is the present in the mind. Mind is a dynamic form. It is not tangible and it is not visible. So a local disease in a invisible subtle means intangible, subtle form, primary form of the mind. So mental diseases are nothing but in a case where majority of the prominent mental symptoms are present, and as they are the symptoms of mind, they are dynamic, they are intangible and invisible, only felt by patient and observed by relatives and friends. So we go further. Aphorism number 216. So the further discussion on this variety of mental symptoms, where the mental symptoms arise with decline of corporeal symptoms. So here, for example, given in our textbook of 6th edition that there is first suppuration of lungs observed in the patient and then he is suffering from insanity. So how is the disease progressing? First, there is affection of gross, means physical or corporeal or bodily changes, and now they are transferred to spiritual, mental or emotional organs. So as such there is no emotional organ, but it is just referred. So it is transferred from body to mind. So emotional organ, but no such organ exists physically. So anatomist will never reach with his scalpel as the disease is on mental plane. Anatomist will never reach with scalpel as the disease is on mental plane. It means that even if you dissect the brain, you will not find any mind present physically anywhere in the brain. So these mental symptoms are present as thoughts in the mind. Many physical ailments of acute character transform from insanity and then physical symptoms cease. So they transform from the physical to mind, from the physical plane to the mental plane. Okay, so mental symptoms arise with decline of corporeal symptoms. Thus, anatomist will never reach with the scalpel. So, he cannot remove this disease with his scalpel as the disease is not in the material form. The disease is at the dynamic level at mental plane. So, this disease is spiritual time, dynamic time, mental or emotional plane, and emotional organ does not exist physically. So we go further. So here in aphorism number 217, Dr. Henneman is discussing that physicians should understand both physical and mental symptoms which are present at two planes, at the level of body and at the level of mind. Whatever symptoms which are at the level of body are visible in the form of pathology, but symptoms which are at the level of mind, even if they are abnormal, extremely abnormal, they are not visible. So remedy is selected in such a way that in its pathogenesis it has covered not only physical symptoms but mental and emotional symptoms as well. It's called as totality of symptoms. So for the purpose of extinguishing the disease, for the purpose of curing the disease, remedy is selected in such a way that in its pathogenesis it covers not only physical symptoms but mental and emotional symptoms as well. Thus, the totality covers the both physical as well as mental and emotional symptoms, and the remedy also must cover in its pathogenesis mental and physical symptoms both. Then only it will be able to act curative. Then only it will be able to act curative and will be successful in curing this disease. So it is physician's duty to understand both the symptoms, the physical as well as mental symptoms present in the patient, and remedy should cover the pathogenesis at both the levels, physical as well as mental level. So the totality of symptoms is constructed by considering both mental as well as physical symptoms. So, a remedy will act curative only if it is producing the symptoms at the level of body and mind, which are matched with the patient's symptoms. So 218th aphorism. So now we have constructed the totality. Totality belongs also the accurate description of previous phenomena of corporeal disease. So in the totality we have to cover the evolution of this disease from body to mind. So totality covers both physical as well as mental symptoms. So how the patient landed in one-sided diseases with predominantly mental symptoms, which started actually with the physical symptoms and later progressed to the mental or emotional symptoms. So it all should be considered in the totality. So totality covers the evolution of the disease. The history can be found from patient and his friends and relatives. So Dr. Hahnemann is very clear that even though today the mental symptoms predominate, how the mental symptoms so far have traveled this journey from original physical symptoms. So everything must be considered in the totality of symptoms. So we go further. In aphorism number 219, Dr. Hahnemann discusses what is lucid interval. So, lucid interval is transient elevation of psychical symptoms. So, here patient is temporarily free of the mental symptoms. So he is possessed of his senses, and the corporeal symptoms may become prominent during lucid interval. So during lucid interval, the mental symptoms are better, they are alleviated, but corporeal symptoms may become prominent. The importance of lucid interval is that it has medico-legal value. Patient's treatment given during lucid interval is considered valid. So what is the importance of lucid interval? That the patient's statement given during this phase is considered valid and it has medico-legal aspect, that the dying declaration made during this lucid interval is considered valid. So we go further. Aphorism number 220 of this presentation, the last aphorism. So, the state of mind and disposition is observed by patients, friends, and also by physician. Totality of symptoms of disease is constructed. Simillimum is the one which is capable of producing similar striking symptoms in the prover, and it is noted in the homeopathic materia medica, and thus this simillimum is selected for this patient and administered. Especially there are disorder of mind symptoms which are noted in the proving of this simillimum. Antisoric remedies are prescribed if the physical symptoms lasted for some time. So, prescription of deep acting antisoric remedy is essential if the physical symptoms have lasted for certain period of time. Thus, the mental symptoms arising with the decline of corporeal symptoms. The example considered was the decline of corporeal symptoms led to the presence of the development of mental symptoms. So, in a case where the patient is giving the symptoms of depression, that all the totality will be having the symptoms of depression predominantly. But if there is history of physical symptoms and which were the at the onset must also be considered in the totality, and remedy should be selected which is having both these symptoms of body as well as mind. So we stop here and we we will further continue the discussion next time. Thank you.